So hi everyone, welcome to Fitness Friday by Rose Walk, and today's Fitness Friday is a special episode because today I don't have just one but two and plus one, three guests today with me. I have with me Dr. Shelly Singh, Senior Consultant OBGYN, Rose Walk Hospital. Hi ma'am.
Hi, Mahima.
I have with me Dr. Veenu Sharma, Senior Consultant Anesthesiology. Hi ma'am.
Hi, Mahima.
And I have with me Dr. R.G. Hola, Senior Consultant Pediatrics. Hi sir.
Hi, pleasure to be here.
Thank you so much, sir. So today's episode is all about preparing for delivery and what happens after delivery. So without taking much time, I'm going to get started with today's session. So hi, ma'am.
Hi, Mahima.
First, I'll start with you.
Yeah, sure.
So please tell us something about how can a woman prepare for her birthing?
Okay. So most times, most of you would already be antenatally booked with a particular doctor, your obstetrician. So as you near term, at around 36, 37 weeks, it's a good idea to discuss the delivery plan with your doctor. Have a very candid discussion with her because let her review your, all your history once more, all investigations, and case by case, it is to be decided what would be the best way for you to deliver. And always know and have an informed decision about how you want to deliver. Moreover, always remember that this should be a flexible kind of a plan because if plan A fails, sometimes obstetrics is so tricky that we may need to change over to plan B. So whether it is a normal delivery or it is a cesarean or you plan for a painless delivery or we are even planning a VBAC is all going to depend upon the merits of every case. So make sure that you've had a good discussion with your doctor well in time before you go into labor so that both of you are sorted out in your minds about what is actually going to be done, and it always should be a flexible plan, like I said.
So when is the right time for a woman to come to the hospital?
Okay, so the signs of labor are contractions. Now, how do contractions come? They are basically pains which are going to come from the back and they will radiate to the front, and they're going to be intermittent pains. So initially they may come at an increased duration, and however you'll find that the frequency will then reduce in the sense that you will have pains coming every 5 minutes, every 3 minutes or so, and these contractions can last from anything like 30 minutes to even 30 seconds to even 45 seconds. So they're going to be intermittent pains. Secondly, sometimes there can be leaking which may come about. Leaking means that there can be a gush of fluid or there can even be a slow trickle of fluid, very much like urine. It's not like the thickish kind of discharge which is common in pregnancy, but it's going to be like a water bag has burst. Or sometimes there can be a mucus blood-stained discharge which can also start. So any of these signs do portend labor, and that's the time when you must speak with your doctor and just tell them that you would be heading to the hospital so that all preparations are already done in the hospital.
So any particular list that a mother can follow when she prepares her bag for the hospital?
Yes. So in fact, this should also be prepared at around 36, 37 weeks as soon as you start your 9 months. Most hospitals do have a list, so that you don't have a problem. So we do have a list even at Rose Walk, whereby we tell you what all is to be brought for the mother, what all for the baby, and what all for the husband also.
Yeah.
Because little things like charger of the phone, your credit cards and other things are all required, your toiletries. So all those things are mentioned here because it's actually a time when one can get very panic stricken. So it's important that you already have a labor bag in place.
And then what are the different types of delivery that is possible?
Yes, so like I just told you that there is something which is called natural birth. The name is now becoming a little redundant. In fact, what we say is that it is basically unassisted in the sense that minimal aided birth in which hardly any painkillers are used, hardly any medicines are used. So that's one option. Then of course we have the normal vaginal delivery which may be accompanied or may not be accompanied by an episiotomy or a cut which is given. A painless delivery or with the help of epidural is also a possibility. And of course, we also have the option of a VBAC. A VBAC basically is vaginal birth after cesarean section. If you've had a cesarean section in your previous pregnancy, in some cases, after reviewing, that everything is fine, we can also attempt a normal delivery. However, it always comes with the adage that sometimes we might require to do an emergency cesarean there as well. So any of these can switch to the other depending upon things which change during obstetrics, and also suppose you are not able to tolerate pains, or according to however things are going along that labor, which is actually a long process.
And what should a woman expect when she's in the labor?
Yeah, so most times, I'll just talk of someone who's not really a high risk patient. So, talking about a patient who would, we are expecting a normal delivery, everything is fine. We are going to regard it as something which is quite, let it be not so, you should not be so panic stricken about it. We ask you to drink clear liquids, we ask you to walk about in the room also. Sometimes we don't even require to give you a drip. So you're walking around. Sometimes we even ask you to do your squats, your ball. You can sit on the ball that we do in your wellness classes. So you need to breathe well, as you would have been taught again. So you need to do all of that. So initially, of course, since it's a long procedure, in the first stage of labor, we definitely ask you to do all of that and keep it as, it's of course not a fun time, but then keep it as fun as possible. However, if you feel that the contractions are becoming too painful, because every girl is different, you can request for an epidural. In fact, epidural can be given at any time during labor whenever you do request that.
Right. So if we talk about epidural being ma'am's, I would say the favorite subject that we can talk about with Dr. Veenu. So what exactly is a painless labor option?
So see, when you talk of painless, then it's epidural which falls into the category. But there are other methods of pain as well. I'll just mention them in brief. So there are these intravenous or intramuscular injections, but they are not given during labor. They are given after the birth of baby to ease that pain of episiotomy and all. We don't encourage them during the process of childbirth because we don't want any harmful medications passing on to the baby. Then the additional agents like oxygen, a mixture of oxygen nitrous, which is the commonest, the best, and the most widely used, that can be given. So that is good for painless labor. But if you talk of painless labor in truest sense, what relieves it the best? It is the epidural. So world over is the favorite, safest method of pain relief during labor.
And for how long can a woman keep the epidural on?
As long as the labor lasts. And we can even continue it after labor for relief of pain for episiotomy stitches, or in case a person has to cesarean section can be done via that epidural, and then post-op pain relief can be given through the same catheter.
So ma'am, can you please tell us something more about the role of epidural in painless labor?
Right, so since we are specifically talking of delivery, I will just mention that when the mother takes epidural during labor, so at the time of childbirth, some amount of medication can be given through that. A special point I would like to mention here is that it is analgesia, which is pain relief. It is not anesthesia, which means numbing out. So we aim and we promise about 60-70% relief, which is quite good. That makes you comfortable, but at the same time, it helps. It does not blunt the sensation of baby's head against the perineum and vagina, which gives an urge for you to push the baby. We want, if common goal is, everyone's goal is normal labor in here, and we want you to be an active participant, because without that it will not be possible, and we don't want unnecessary instrumentation or prolongation of the stage of labor. So we keep you comfortable, and even if you want to be numbed, neither your gynecologist nor we would really encourage that. And after the labor, we can give you additional, childbirth, we can give you an additional dose through that, and also supplemented with intravenous and intramuscular injections. So overall, it becomes a very comfortable process.
So what would be the best time for a woman in labor to take epidural?
As Dr. Shelley said, anytime, but from our side, once true labor has been established, anytime epidural can be taken. And we recommend the sooner the better, because cooperation from your side would be more, it would be easier for you to sit through that, those 10-15 minutes of the procedure. And also there'll be more benefits in the sense that you'll be pain free for a longer duration of time. However, it still depends on person to person, and of course from gynecologist to gynecologist also. Some of them have a very specific, landmark. They would say in the centimeters is what we would recommend, but medically it can be given anytime.
Right, right. So, now coming to the point when the baby is born and your main role and main action starts. So, sir, what to expect when the moment the baby is born?
Right. Before I go into that, I'd like to say that a neonatologist role often starts before the birth of the baby. It starts with finding out about any risk factors that a mother may have in her pregnancy, which could impact the baby. It could have to do with the type of delivery we are expecting in the baby. It could have to do with a little bit of counseling on what to expect. So, as a neonatologist, I do like to get involved during the antenatal period itself. Now, once the baby is born, we have certain guiding principles. The first guiding principle is that we would like to re-establish contact between the baby and the mother as early as possible. So once the baby is born, let's say the baby is born by a natural birth, that is a vaginal birth, then we immediately put the baby on the mother's abdomen. And while the baby is on the mother's abdomen, we dry the baby, and during that time do a quick assessment to see whether the baby is all right or not. If there's a problem with the baby and the baby needs some special care or resuscitation, then we would take the baby away. But otherwise, we would like a few minutes of direct contact between the mother and the baby. In a vaginal delivery, we also try to establish breastfeeding. So we put the baby close to the mother's breasts, and babies actually crawl towards the mother's breast, and they actually take the nipple on their own, even without having to teach that to the baby. Now, when there's a cesarean birth, obviously we can't put the baby on the mother's abdomen. So we take the baby around and we allow the mother to see the baby. We do allow skin-to-skin contact between the baby and the mother's upper part of the body, which is outside the sterile operation field. We also involve the father in that process. So that's the first principle of trying to re-establish contact between the mother and the child as quickly as possible. And the second thing that we are very, very keen about is to establish breastfeeding. Now, breastfeeding is something which the earlier it's established and the more frequently it's done, the more successful it is. So in a vaginal delivery, we would try to put the baby to the breast immediately after birth. In a cesarean delivery, we normally wait after the initial skin-to-skin contact. We wait for the surgery to be over, and then we take the baby to the mother's side, and then we put the baby to the mother's breast.
And so once the mother and the baby are shifted to the room, then what should the parents expect from the baby's diet?
So there are, every baby comes from a clean and sterile, warm environment where the baby has been given a continuous flow of nutrition. So there are three things that we need to be careful about. The first is we need to protect your baby from infection. And that can happen if we restrict the number of visitors, we use hand sanitizers, and anybody suffering from any illness like a cold, cough, flu, or an eye flu, or a stomach upset should avoid coming close to the baby. The second is about feeding. The baby needs nutrition because the moment the umbilical cord is cut, the continuous flow of nutrients stop. So we initiate breastfeeding and we try to put the baby to the breast as frequently as possible, and we encourage skin-to-skin contact. And the third is temperature. So obviously, babies are born in every type of temperature, in every type of environment. So clothing needs to be appropriate. So these are the three main things that we need to look into.
So, sir, since you mentioned the clothing, I would also like to ask you what would be the right kind of layering in this weather for a newborn baby?
Yeah, so in winter and also in summer, actually, when you have the air conditioner running on full blast, it's always better to use multiple layers of clothing. Rather than using heavy woolen clothing, we always recommend that the baby should wear inner layer made of cotton, then a t-shirt on top of that, then maybe another t-shirt. So multiple layers actually trap air. They allow the skin to breathe, and at the same time they provide warmth. Babies often in cold weather need to have a cap. And I always recommend to parents to get a feel of the baby's skin. Put your hand under the baby's shirt, get a feel of the baby's skin, keep touching the hands and feet of the baby. So if you feel that your baby is getting overheated, you could take off a layer. If you feel your baby is getting cold or hands and feet are getting cold, you could add another layer and put socks.
Right, sir. And so once during the 2-3 days of stay in the hospital, and then the parents are ready to take a discharge and to go back home, any particular points that they need to keep in mind when they go back home?
Yeah, I'll just come to that. But before that, I'd like to say we screen all babies. We do a screening when we examine the baby at birth. We screen for hip dislocations. We look at the baby's oxygen levels in all the 4 limbs. We also take some blood samples from the umbilical cord. We check the baby's hearing. We also shine a light into the baby's eyes to look. So there are various screening tests which are done through the blood, through clinical examination. Now, when we observe a baby in the hospital, we are looking for things like how well the feeding is going on. Is the baby maintaining temperature? Is the baby looking sick? Is the baby developing jaundice, which is a natural thing which happens in every baby? And is that jaundice going out of range? And once we discharge the baby home, then basically we tell parents to look after the 3 main things. Protect your baby from infection, give timely feeding, which means you have to wake up even in the night and feed the baby. And thirdly, maintain an environment which is comfortable, for the thermal comfort of the baby. So these are the 3 main things. We normally call back babies on the 3rd or 4th day after the discharge to check for jaundice, to check for weight loss, to look at the skin, to look at so many things. And then after that, generally, by then the parents have got used to the baby's got used to the parents. So then most of the things can happen over the telephone or over video conference.
And sir, any particular initial vaccinations also that you would like to mention?
Yes, when the baby is in the hospital, we give hepatitis B and BCG. And on the day of the baby is being discharged, we give polio drops. So that's the initial set of 3 vaccines which are mandatory, which are given to each and every baby. And then after that, the next set of vaccines starts at 1.5 months. In between, there's nothing.
So now I would like to take questions from the audience. And I already have first question ready. So I have the first question for ma'am, Dr. Sherry. So somebody from the audience is asking, my name is Anita. Can you please suggest some non-surgical vaginal rejuvenation methods to go after delivery?
Yeah, sure. There are some methods which are available, but for those, then you would need to come to the hospital, and we don't prescribe that immediately post the delivery. Yes, it takes, when you come for your visit at 6 weeks, when, everything has gone back to the normal non-pregnant state, in that case, we can discuss, and there are various methods which are available for, for the laxity of the vaginal skin and for vaginal rejuvenation.
I have a question from the audience for sir. Somebody is asking, my name is, not the name, my baby is 4 months old. Can I go for the 6-in-1 vaccine to prevent my baby from all the 6 diseases?
Well, the 6-in-1 vaccine, as I understand from the question, is what we call Easy 6 or Hexaxin. It's a part of the routine vaccination which we give in the hospital. So let me tell you about the vaccines. When the baby comes back at 1.5 months for the vaccination, we give 1 injection which contains the DPT, the Haemophilus influenzae, hepatitis B, and the injectable polio. All that is given with 1 syringe. So that's a single prick. So that's the 6-in-1. In addition to that, in Delhi, it's also recommended by the Delhi government to give a pneumococcal vaccine. So we offer that to every baby. And in addition to that, we give an oral rotavirus vaccine.
Then we have another question from the audience. My name is Radhika and I am in my 1st trimester and I am diagnosed with placenta previa. If not treated well, will it cause any harm to my baby or will it result in miscarriage? I guess this question is for you.
So in the 1st trimester, we don't actually call it placenta previa, it's a low-lying placenta. A lot of times, since the uterus is small, at this stage the placenta may be low-lying initially, but as you do subsequent tests, because as the baby grows and as the uterus also grows, the placenta just translocates to the upper segment as well. So do not be hassled in case it's a low-lying placenta in the initial part of your pregnancy or in the first trimester, because most cases, like I said, it's going to become high in the subsequent or the subsequent to subsequent ultrasounds. However, you must remember that in case it is a low-lying placenta, there sometimes may be chances that there could be bleeding. So we then ask you to abstain from intercourse. We do ask you to stop lifting heavy weights and inform us in case there is any bleeding. Otherwise, it is something which is very normally seen and it will get rectified in the next step.
Right, thank you, ma'am. We have another question from the audience for Sir, Dr. Hola. Somebody is asking, can you please explain the importance and role of prebiotics in developing babies' immunity?
Well, let's first understand what prebiotics means. There are certain things known as probiotics, which are actual bacteria which live inside the gut. And the prebiotics, to put it in very, very simple terms, is the food that these bacteria take. So when the baby is born with a sterile, every part of the baby's body is absolutely sterile, which means that there are no gut organisms. And as the baby comes in contact with people, with the mother, with the family, and with the environment, the baby gets colonized with different bacteria. Now, mother's milk is the richest source of prebiotics. And there are so many different kinds of compounds which are present, which really, to some extent, the formula companies have been trying to reproduce that and provide that in various formulas. But really, the natural pattern of prebiotic foods which are available in breast milk cannot be reproduced by any artificial means. And therefore, if you're breastfeeding your baby, you don't have to worry about giving prebiotics separately to your baby.
Right.
I hope that answers the
yes,
question.
Yes, absolutely. We have another question from the audience. My name is Rohit and my wife has just delivered a week ago and she's becoming very weak day by day. Can you please suggest any plan for her so that she can recover ASAP?
So Rohit, I would like to know what exactly you mean by weak. Because of course, this is a time when one does feel weakness. There has been a certain amount of blood loss which also happens. Plus the entire procedure, of the whole process of labor, of delivery, etc., can be quite daunting to a lot of people. So in case you're talking about something like just weakness, then I would suggest that there are some prenatal vitamins and iron which are added in any case 7 days after the the delivery. And secondly, what is important is that some form of even exercises are recommended. In fact, Mahima, you could just tell us about what are the basic things which they can do immediately post delivery. And again, however, if you feel that it is totally out of proportion to how much has been the blood loss, or you could meet your doctor. In that case, it needs to be evaluated as to why that weakness, why there is so much of a profuse weakness that is happening. But of course, you could just tell them about some of the basic things. Eat well, that is another thing that I would suggest, because eating healthy, small, frequent meals, make sure that there is enough green vegetables, there are seasonal fruits, there are enough proteins, because this is a time where there has been blood loss, there is tissue healing, rejuvenation, which is happening right now. So those are the body's needs. Plus, she's also feeding the baby, sleepless nights, all those could also lead to weakness. And that's the reason we do recommend that even calcium supplements should be taken till the time you're breastfeeding the baby. So many changes in lifestyle, so many new things which come about, but we definitely need to take care of both our babies as well as our puerperas or the girls who've just delivered.
Right. I think to add to that, ma'am, I think family plays a huge role. So if the mother needs some break and she needs her me time, please you can take care of the baby and let her take a nap. Let her get some time to do some basic postpartum exercises that will help her to build up some strength in her body. Please pamper her as much as you can. Make sure that you're making her feel good about herself so that she prevent postpartum depression from happening. Let her eat what she likes to eat. So please make sure that she's getting her food on time, because when she has to feed the baby every 2-3 hours, she also needs to take something to eat so that she can feel fit and prepared to do the next feed. And mini cat naps are very important because, like ma'am mentioned, sleepless nights with feeds is one of the commonly seen issues in new mothers. So please make sure that whenever the baby sleeps, you let the mother also sleep, and both the baby and the mother can sleep together. That also helps in bonding, and it improves the level of satisfaction even in the baby, and the babies also feel emotionally more secured, and the mother also gets some happy hormones through that. So on that note, any takeaway message from all of you? I'll start with you, ma'am. So
Okay, so I would say that this is a time which should be a happy time, not be very scary memories. That's why it's important to already decide and have some kind of a plan ready. Also, like Dr. Holla just said, that a multidisciplinary, multi-speciality approach always helps, because just in case there is something that I need to talk to Dr. Holla about the baby, we should have already discussed that well in advance. Apart from that, of course, COVID times, things are going to change a little with regards to delivery. So please note what are the changes which most of the hospitals are recommending these days. Fewer people who would be attendants, tests which need to be done. So all those things will probably not be add to all that fun which used to be there in deliveries earlier on. But if we do know about it, it's of course for our own benefit and for our own sakes. Let's have a delivery which is happy, though it may not be as happy as it used to be in pre-COVID times.
right. And takeaway message from you, ma'am.
So if any one of you wants to know more about epidural, please feel free to meet us, talk to us. It helps to take the decision beforehand. However, it can be taken anytime during labor. And don't worry, we're all there to support you and make sure that it is as comfortable as possible for you as an experience.
And sir, any takeaway message from you?
Well, I'll only repeat what you said a little while back, and that was that the birth of a baby is, it's something in which the entire family should be involved, and the, mom passes through a very difficult time. She's given birth. There's a baby. The baby's life and feeding and nutrition, everything is dependent on her. So it can be a little overwhelming. So I'd say the family must get involved, must kick in, and give a lot of support and comfort to a new mother. I think that's
true.
That's very important. So on that note, I would like to thank my great experts who have joined me for today, Dr. Shelly ma'am, Dr. Dinu ma'am, and Dr. Hola sir. Thank you so much for joining in. And it was lovely talking to all the great experts from Rosewalk Luxury Hospital for Women. So if you are planning to have a baby soon, or if you're all set to deliver soon, do come and visit and have a look at Rosewalk Luxury Hospital for Women in South Delhi. We'll be happy to help you out. Thank you so much for joining in today, and wishing you all stay safe, stay healthy at home, and don't forget to follow, I would say, physical distancing from people so that you don't catch COVID. Thank you so much. Have a great day. Take care. Bye-bye.
Bye.
Bye.